please.
Set the scene. We're in a hospital room on 1 South. Gina Cast was admitted through the ER. It is late in day 1. X-rays have been taken. Complete oblique closed fracture of the right femur. Our objectives are to demonstrate care of a patient with a femur fracture and demonstrate proper application of a traction device.
Hello, my name is Marie. I'm an instructor here at OSF. I have Kelly here today, who is a student, and she's going to be applying your traction today.
Hello, Miss Cass.
Let me just get your name and date of birth. I have to put on my gloves and wash my hands first.
My name's Gina Cast, and my birth date is 6/5/79.
Okay, well, this is our Gina Cast. So, we're going to have Miss Kelly take your assessment.
I'm going to start with your pulse.
Yeah, just put that down. There you go. Work around all the objects in the room, Miss Kelly.
And taking your respirations.
Okay.
I'm going to listen to your lungs.
That's right.
Breathe in.
Skin on skin. Good job, Kelly.
And out. One more time. I'm going to listen to your heart. You can breathe normally. Now I'm going to listen to your bowel sounds.
Remember, that's a minute each quadrant, Kelly.
Yes. I recall. And do your blood pressure.
You can move the IV pole if you like. She's got some tubing length on there. Make sure the bladder's over her brachial artery. And after that, we have to take temperature. Don't forget.
Thank you. I would have forgotten.
I'm here for you, Kelly. Utilize me. Okay, and her blood pressure was? Do you remember?
120/80.
Oh, perfect, Miss Cast. You're doing well.
And her temperature was 98.5.
Oh, perfect. She's doing so well. Okay. That's right. We want to put her side rails up. Okay.
I see that your nurse gave you a Norco 30 minutes ago. On a scale of 1 to 10, how's your pain right now?
It's about a 4.
Okay.
All right. Well, we have an order from the physician to apply traction device with 5 pounds on your left leg.
What is a traction device?
Or right leg, I'm sorry. A traction device, well, the doctor has realigned your leg, your femur bone, which is your thigh bone up here, and the traction is going to gently pull and keep the bone in alignment while stabilizing with the boot, okay?
All right.
So I'm going to put the pulley on first, and then I'm going to let Kelly take it from here, okay? I'm going to hold and immobilize. And all your stuff's right here, Miss Kelly.
Okay. So this is the boot.
Okay. We know the boot goes which way?
I'm assuming this way.
You got it. Okay.
Like that.
Yeah.
Okay. I'm assuming this goes this way.
Yes, ma'am. And then that one's going to be the one we put in first in the Velcro straps. And then
Oh, I
strap
see.
from the foot up.
Okay. How tight do I go?
You want it to be tight enough to immobilize, but not enough to cut off the circulation.
Like that?
Like that.
Okay.
And you can still feel your toes and you can wiggle your toes.
Yeah.
Okay. And then you're going to check capillary refill.
Okay.
Oh, losing some over. Okay.
Looks good.
All right.
Should I check the pedal pulse too?
Yeah, let's check the pedal pulse.
I'd say that would be a 2+.
Okay. Not cold.
A little cold and hard.
A little cold. That's to be expected. She is a mannequin. And then we're going to apply our weight,
Okay.
5-pound weight.
What's the weight for?
This lightly pulls on your leg, and this is what keeps your bone aligned, okay?
All right.
Then we want to remember, after we place the weight and the traction device has been on for a while, we want to reassess the skin, make sure there's no creases or wrinkles in the sheets or the pillow. This way we're going to decrease our odds of having any pressure ulcers, okay?
Okay, that's good to know.
Okay, we'll take
How long am I going to have to wear this?
The traction device stays on for about 48 to 72 hours, or until we can get you scheduled for surgery, which I've seen your surgeon out in the hall. I believe he's going to come in here and talk to you about that in just a little bit.
Okay.
Okay. And one more thing, we're going to we could put a pillow or a draw blanket, roll
Oh.
that up, and we're going to put this right here so we don't have any external rotation, because we
Oh,
want her
okay.
to be internally rotated
Mhm.
per the doctor's orders, and then we'll just check on the roll or the pillow, and then that way the bone heals the way that we are wanting it to, okay?
That makes sense.
Okay. So, we want to make sure also that she is moving her extremities because she is immobilized.
Mhm.
This way, this will keep the risk of like pneumonia and other
I see.
hospitals.
So all her other extremities that aren't in traction.
That's correct.
Okay.
Very good, Miss
You okay with
Kelly.
that, Miss Cast?
Yep.
Okay.
All right. Well,
And we should leave the bed elevated, or do
Well,
we put the foot back down?
no, we want to keep the foot up, so we're going to decrease swelling and
Oh,
all
okay.
of that. So this
I
will.
just thought we had it up for us to be a little bit easier, but okay, that makes
No,
sense.
we want to keep this up. Okay, so it's shift change, so we got to go and get the other nurse and let her know what's going on with you. And I wanted to show Kelly your fracture. It's a closed, closed fracture, complete break. Okay. All right, so let's go report off. Okay, Kelly, proceed.
Hi, Pam. Hi. This is Miss Cass.
Hi.
I've been working with her today.
Okay.
She was in a motorcycle accident yesterday, and she has an oblique closed fracture of her right femur. She was admitted this morning, and her pain meds were given about 60 minutes ago. We did do a pain assessment beforehand. She was at a 4, and she tolerated the traction application without any complaints about 30 minutes ago. And afterwards, actually, we should ask you now, how is your pain on a scale of 1 to 10 after we've done the traction? 3. Okay. The surgeon did come in a little bit earlier in regards to her surgery, which that was scheduled for tomorrow. Her vitals were taken beforehand, and they were within normal limits. She was at a 120/80, and her temperature was good. And I believe that's everything.
All right. Was there any other complications related to her accident?
Nope, just the one.
All right. Sounds good.
And scene.